Good afternoon, everyone. Thank you for joining us on our media briefing for this Monday, a little bit of rainy Monday morning. We're going to get started on our briefing with very exciting news about a new testing site that's underway on the peninsula, and we're joined by Supervisor Mary Adams, who I understand was at the site this morning, and you can tell us all about it.
Yes, thank you. I hope that I'm coming across well enough for you today. It is really exciting that we have been able to forge a partnership with Monterey Peninsula College, which is the testing site, Planned Parenthood Marmonte, my District 5 office, and also Supervisor Jane Parker's office. And what we're able to do is work in partnership with everyone to be able to do testing at MPC. We started this morning, and the hope was that it would be a bit of a trial run, but we really did a lot of people coming through. The days of the testing are going to be Monday through Thursday from 9 a.m. to noon, and then again from 1 to 4. So next week, however, because it's Memorial Day, there will not be testing this next Monday. However, we'll pick it back up again Tuesday through Thursday. The tests are being done by trained professionals. Obviously, it's done on site. They're being processed by Quest Labs, and they're using the swab method. It is the current one. Do you have COVID as we test you now? You can sign up for it. You can go online to make an appointment, but you don't need to have an appointment. We're following the same guidelines that we have with the two sites that are down, one in Salinas and one in Greenfield. We're following the same process. However, this one is a drive-through, so you don't even have to get out of your car. It is not just open to the first responders or essential workers. It's open to everyone. And I can tell you today, there were some first responders there. In fact, I had the opportunity to watch one of our wonderful Monterey firefighters, who is also a paramedic, get tested. And it seemed like it was painless and worked well. So as I mentioned, we're going to continue to do this. Hopefully until June 15th. That's the time frame that we have. And we really are encouraging everyone who is interested in being tested to come down and do so. You don't have to have a referral from your doctor. You don't have to be exhibiting symptoms. You simply have to come down and do it. So as I indicated, you can either fill out paperwork online, or just when you get there. It's very easy to do. We also suggest, if you have health insurance, please bring your health insurance cards, and the health insurance will cover it. If you do not have health insurance, you can come through anyway, and you'll be able to be covered under one of the special programs that California provides. Any questions?
Thank you, Supervisor Adams. I was also hoping Lupe Rodriguez from Planned Parenthood Marmonte might also be on the call. She might be able to speak to a little bit more about it. And I am not hearing her. And I know Supervisor Adams, you have to leave. Are there any questions for Supervisor Adams about the drive-through testing before she has to leave?
Seeing none, let me just make a couple of other quick comments. And
Sure,
today, because it was virtually a sold-out crowd, there were a lot of people there. Planned Parenthood is going to be doubling the staffing. So from tomorrow forward, there should be a lot more people on board, and it'll be a little bit faster getting through than I know that it was today. But I'm just very delighted that we're able to offer this. And many more people now are looking forward to having the test done. And this is the best way that we can move forward on hitting some of the boxes that we have to fit for the readiness determination that the governor is saying we must have before we can move forward more deeply into phase 2, which is where we are now.
Mary, I have a question that came through. Could you repeat the date and time for the testing?
Yes, it will be Mondays through Thursday from 9 to 12, and then from 1 to 4. However, we will not be testing next Monday, Memorial Day.
Great. And then here's a question for you, but you can also play Dr. Moreno
Oh
while you're
dear.
here. The county
I've
is
never
expecting,
even played one on TV. I'm not sure I could do that.
is the county expecting or hoping to see a spike when encouraging more people to test?
I cannot say that we are hoping to see a spike, but we do feel it's important for people to be tested. I think it's everyone is concerned about it, so we're going to be uh, just encouraging everyone to come and get tested should they be interested in doing so.
And then part of another question that came in, you might be able to speak to. How do you encourage those who are asymptomatic to test?
We're reaching out to businesses to suggest to them that any employees that they have now or that they've had in the past and have contact with go to the test site to be tested. We're also putting out press releases, I think through your office, Maya, if I'm not mistaken, that will encourage people to do so. Thankfully, my hope is that because all of you are on site with this now, that you too will promote the test site as well. As we have two other test sites that are doing well. They've tested approximately 1,675 people to date. And we're hoping that this additional site will bring an opportunity for the people of the Monterey Peninsula, particularly District 5 and District 4, to come over and get tested.
And then could you clarify what Planned Parenthood, with their involvement with this peninsula site?
Yes, this is really a wonderful circumstance for having good friends and relationships. A mutual friend of ours from District 5 serves on the board of directors of the local Planned Parenthood organization. And they heard that in New York, they had done this sort of partnership. And so they decided, wouldn't that be a great opportunity for us here? So they contacted my office and talked about how we could make it work. And zip, zap, zoop, we contacted MPC. Fortunately, my chief of staff is the chair of the board of trustees of MPC. So it was a nice little tight connection, and we just moved forward with it right away so that we can provide this for the people who really want and need it.
And also, are you able to speak to any about how the site is funded?
You know, actually, I should have the answer for that, and I don't, but I would expect that it is Planned Parenthood and a lot of in-kind contributions, in-kind from Monterey Peninsula College, in-kind from Planned Parenthood, but that's speculation. I prefer to have the real answer, and I would need to get that from Planned Parenthood.
And then is there a limit on how many times someone could be tested? This may be a question for Dr. Moreno, but there's no waiting and there's no requirement for the Peninsula test site. If someone wants to come, they don't have to make an appointment, they can just show up.
They can just show up, that's correct.
All right, thank you. That looks like, unless there's somebody who wants to ask a question live, that's all the questions I have for you right now, Supervisor Adams. Thanks very much for joining us.
Thank you very much. Bye-bye.
Bye. And next, I'd like to have Susan Bernal. She's the Emergency Department Director at Community Hospital of Monterey Peninsula. And she's joining us to talk a little bit about what's happening over at the hospital in terms of safety and the dangers of putting off medical care. Thanks very much for joining us, Susan. And I'll need you to unmute, if you could. I think you're muted at your end.
Can you hear me?
I can. There you go.
I'm so sorry about that.
No, thanks for joining us.
Thanks. Yeah, thanks for having me. So we, over here at CHOMP in the emergency department, and actually our entire hospital, we have, effective today, we have started to open more of our services up. But specifically related to your question, putting off medical care because of this pandemic is a huge concern. And we've already seen some cases where people have put off medical care and then they're just much sicker when they get here. So we want to make sure that people really understand that coming to the hospital is very, very safe. Although we've had extremely low numbers of our COVID positives here at CHOMP, we still are extremely diligent in practicing significant safeguards to keep our patients, our community, our staff very safe. So.
Great. Thank you very much. While we have Susan here, are there any questions for her about those issues and activities at the hospital there? I think you've covered it.
Awesome. Thank you.
Thank you, Susan. And then I see we have Charles McKee, our CAO, who sometimes we let him go first, but this time we may let him wrap up. Thanks for joining us at noon.
Yeah, thank you, Maya. I'll hit clean up here, as they say. Really appreciate the way that we're tying together all the pieces to combating the pandemic, whether it's the hospitals with their care and making sure that people with that need care for COVID-19, or others who just need medical care, recognizing that it's safe to do so at this time, and they shouldn't be putting that off. I think that's really a key to making sure that our economy gets revitalized, that our people understand that they can have some semblance of normalcy, even if they're not going back to everything that they used to do, but that we have those pieces in place to make people feel comfortable going about their daily lives, obviously with some limitations. A key piece of that is this idea of testing. And I know there are questions out there about where our capacity is and where our volume is, and our capacity is way up at this point, and we think we have sufficient capacity to handle any of the variance criteria that might be set by the governor's office on reopening in the various stages. The volume is also increasing. We don't have all the test numbers in from these newer locations yet, but I can tell you that the numbers are increasing, which is great, and we want to keep those numbers going up, because that's going to be a key metric to be able to reopening our businesses and our economy, is to show that we're having testing success. And that people are going out to get tested. Obviously, the more we test, the more likely we're going to have positive results, because there are many people out there who are asymptomatic, who may actually be carrying the virus, some of whom may only feel a minor illness or no illness at all, but still may come back as positive. And we want to make sure that we're addressing the needs of our community by finding those positive patients, positive persons, and getting them in the right type of isolation from the rest of the community, so that they can heal and it's not spreading throughout the community. So while we might have an initial uptick in our numbers because we're testing more, I think in the long run we're going to see a huge benefit to our community, because we'll know. People will know whether they're positive and be able to take the appropriate measures to stay safe and keep our community safe. With that said, we are looking at the various pieces of the variance process that the governor has laid out, and we expect, I think the governor is probably talking right now on his media briefing about some additional changes to the variance process that we might be expecting statewide. And we're going to look at those to see where we as Monterey County fit. We recognize that we are not there yet with some of the variance numbers that originally set out by the state to be able to open up more quickly than the statewide authorizations are in what's called stage 2, but we're getting pretty close, and we think our overall numbers through all the different categories are really pretty good at this time. So with that, I'm open to any questions, and be happy to stay on the line for a little bit longer.
Thank you, please do. I see Dr. Moreno has joined us on the call, and so I'm hoping he'll have a minute to give us a public health update. Hi, Dr. Moreno.
Yeah, good afternoon, Maya. Yeah, so actually, I think a lot of it was already covered. Supervisor covered the new testing location out at Monterey Peninsula College and the Optum testing as well. We have, as the supervisor mentioned, we have a little over 1,600 people who've submitted for testing through the two sites. We've had about a little over 650 people who've attended the site in Greenfield, and a little over 1,000 who've attended the site in Salina Sand. Just over the last 2 testing days, we've seen an increase in the number of people that are scheduling appointments for both of those sites. So I really appreciate everything that you, the media, have done to get the word out and get more people interested in finding out if they're infectious or not. And right now we're looking at, it looks like about 1% of the people who are being tested are testing positive. So it's a 1% positivity rate, which we will continue to monitor to see if that changes as more people are now making better use of the 2 Optum sites. And as Charles said, the new, we're expecting some revisions to the attestation requirements, particularly the indicators and the metrics that the governor has out there now. We believe they're going to change, and when they do, I think more counties will be able to demonstrate that they've done an adequate job of slowing the spread of COVID-19 such that more activities can begin to resume in our counties. So looking forward to seeing what the governor might be announcing today as well. And that's all I have for now, Ma'am.
Thank you, Dr. Moreno. And so I'll start with questions that we've had that have come in. And I think the first one is for you, Dr. Moreno. Given Monterey County has had an average of about 1 death with COVID-19 per week since the shelter-in-place order, and a current average of 90+ new coronavirus cases every 2 weeks, what are the chances of reaching the state's benchmarks for stage 2?
Yeah, so I think it really, I think the question is probably referring to the indicators and metrics that many of the counties have already submitted their attestations with. And I think we're expecting that there's going to be some changes. And once those change, if there are changes and they come out soon, we'll actually be looking at probably different metrics that may or may not rely on the number of deaths, for example. So we're going to have to wait and see. Hopefully there's some news today for us.
Thank you. This is a question that's come up before, but it's good to talk about it again. Is there a limitation on how many times someone can be tested? If they test negative, then develop symptoms later, can they return for a second or even a third test?
I think the answer is yes across the board. In discussions that we've had with the Optum representatives, they admitted that some people may need to be tested more than once, and they did not say that that's not possible. So it seems that people can be tested more than once, and it would make sense that people could be tested more than once because someone may not have symptoms and test negative, and then later on in the future they develop symptoms and they want to know if they have COVID-19. So for the Optum sites, I believe yes, you could be tested more than once, and I have some confirmation from the Optum site representatives themselves. As far as the hospitals, I think people just need to keep in mind that when you go to a hospital, you're going there for a medical evaluation. You're asking a healthcare professional to evaluate you and give you their professional opinion. And so that may or may not include a test, but certainly the hospitals look at each individual when they come in at that on that particular day and consider all the circumstances and make a decision. So someone going into a hospital for periodic intermittent respiratory symptoms could expect that they may get tested more than once moving forward in this pandemic.
Thank you. And another question, has the county health department been working with nursing homes to stop the spread of COVID-19? If so, what measures have been put in place?
So yes, the health department has been working with our local hospitals together to work with skilled nursing facilities. So the residents of skilled nursing facilities from time to time need a higher level of care, and they often are transferred to emergency departments and sometimes have to be hospitalized for a while at a local hospital. So the skilled nursing facilities and the hospitals already have working relationships and work together to follow guidelines to prevent the spread of infectious diseases like COVID-19. And we as a health department, particularly our public health department has been working with both the skilled nursing facilities and the hospitals. So there is guidance that the state of California has issued several, they're called all facility letters because they go to all the facilities that are licensed as skilled nursing facilities in California. They all get the notices. We get a copy of the notice. We review the notice, and then we have meetings with representatives from skilled nursing facilities on a regular basis, and we review the newest guidance that's out there. We try to answer their questions about it, and then assist them in developing strategies to comply with state requirements to control and prevent the spread of COVID-19 in their facilities. And should any of the skilled nursing facilities identify someone, either an employee or a resident that has COVID-19, then we spend additional time with that particular skilled nursing facility to make sure that they're properly implementing infection control, infection prevention strategies to do what they can to prevent the virus from spreading to additional employees or additional residents. And from time to time, a hospital will also work with us, particularly if that skilled nursing facility has a long-standing working relationship with several residents, frequently going back and forth between the hospital and skilled nursing facility. So the hospitals have been involved as well.
Thank you. And with the additional testing capacity, how close is the county to meeting the 650 daily test benchmark that has been set by the state?
So the benchmark or the metric that the state has set has been focused on volume, which is the actual number of people getting tested, not the number of tests that could be done on a daily basis. We're as a community, I think we're making great strides in increasing the testing, the number of people who are tested. We'll just have to wait and see if there are any changes in this that the governor has to announce that might change the way in which counties demonstrate readiness to move forward through stage 2 under the testing criteria.
Thank you. And then do we compare Monterey County with the other counties in our area? Do we know where we are in terms of testing volume, in the middle, behind, ahead?
I haven't been comparing us with other counties in terms of testing volume, and I think that that's something that every county has to deal with on their own. With one caveat on that is that now that we have Optum sites, some of our residents can actually go outside our county to get tested if they want. But the requirement that the governor has put out is for counties. So we have to rely on our own resources for the time being in the Optum testing sites as well to try to get that testing volume up as much as possible. Yeah.
Thank you. And I have a question regarding the MPC site, which I can only take part of right now, and I'll have to forward the other part of this question directly to them. Do the tests that are done at the MPC site, would they count towards the county's daily testing capacity?
Yes, they would. So the state has not determined or hasn't limited the testing capacity and testing volume to only certain testing options. All testing opportunities are included in that volume and capacity. So we're very grateful for the partnership that between Monterey Peninsula College and Planned Parenthood, and working with our county supervisors to get this going. So we really do appreciate that.
Thank you. And we're really pleased that Lupe Rodriguez from Planned Parenthood Marmonte was on the call, was able to join us. And there was a question that came in about how many daily tests that the MPC site can do.
Hi, this is Lupe Rodriguez from Planned Parenthood Marmonte. We are at this point able to do at least 100 tests per day at the site here at Monterey Peninsula College. And depending on community need, may evaluate whether we can do more, but at the time, for the time being, we can do 100 per day.
And there was a question earlier that Supervisor Adams tried to answer, but was going to pass it off to you in regards to how the site is being funded.
Well, we're working through our donor base to be able to fund the site. We are working to ensure that we're able to get information from patients who come by if they have insurance. As you know, the state of California requires all insurance plans to cover the costs of testing. And so we are doing our best to be able to do some billing to insurance. But overall, we are not, turning any patient away regardless of insurance. And so we're doing some fundraising through our own networks to be able to support this work.
Thank you very much. And then Dr. Moreno, I have a question for you on testing sites. Are there plans for more testing sites in the county? Oh, there you are.
So I'm not aware of any additional testing sites. If there are additional testing sites that open up, I would expect that they might be located at outpatient clinics here in Monterey County. Currently, most of the testing sites are emergency departments. There's four emergency departments testing. We've got 2 Optum sites testing. We now have Planned Parenthood Marmonte who's testing as well. And I think Soledad Family Health Clinic is testing. So there are plenty of primary care docs, health clinics in the community. And I think that those might be some sites that hopefully will begin to collect specimens moving forward.
Thank you. And another testing capacity question. If Monterey County isn't meeting testing requirements, could that be attributed to people not wanting to get tested?
So I think it's that's maybe part of the issue here. I think it's also that we've been talking about needing testing for months now, and now that we have more testing, I think it's just getting the word out, and that can make a big difference. Just looking at the last 2-3 days of testing at our sites, they've almost maxed out the testing. They can test up to 132 at each site, and the testing is in the 120 range for the last few days at each site, at the Salinas site, for example. And so, and both sites, and the Greenfield was a little slow at first, but that one's really picking up now. So it's getting the word out through the media and through asking businesses to get tested, asking first responders and healthcare agencies to get their staff tested, and asking doctors and to recommend that their patients and their families sign up to get testing. I think that's made a big difference. And so we'll and it sounds like the clinic today at MPC was a success. And so I think people are realizing that the test is available, and they can sign up, and everyone, I think anyone who, particularly if you have symptoms and you want to know if you have COVID-19 because there's someone that you care about who's struggling with asthma, heart disease, who's older. If you have COVID-19, you want to know your status so that you can isolate yourself from people in your home and not get other people sick, and stay home so you don't get people at work sick.
Thank you. And I have a clarification question on something you said at the very beginning about that the county has a 1% positivity rate. And so the question is that for, if that is for 340 approximately positive cases, does that mean there's been 34,000 tests that have been done? You're
that
muted.
1% positivity rate was just for the Optum sites, with the limited data we have from the Optum sites.
Great.
So I think we're looking at more like a 5 to 6% positivity rate across the county.
Thank you. And then another question regarding the governor's announcement, who is competing with us at this hour at noon. The governor is expected to be announcing today new criteria would allow counties to open even faster. Would Monterey County pursue the fastest possible path or follow the lead of neighboring counties? Is there a process for neighboring counties to all follow the same timelines?
So I think it's a little bit of both. I think we recognize that our families, our communities here in Monterey County spend part of their time in our neighboring counties, and particularly Santa Cruz County and San Bernardino County, for example. And so it's a combination of working with our colleagues to try to have some consistency. So families, whether they work in Monterey, if they work in Santa Cruz County and live in Monterey County, for example, there's some consistency as to what degree the businesses and activities are opened up. So that's one. The other is, I think the other factor is basically we have to look at, even if we do meet the requirements that the governor puts out to attest that we're ready to move forward. I think we as still need to look at how things are going in terms of number of cases, number of hospitalizations, and number of deaths. So what I can say right now is that I think as a community as a whole, we've done, I think, a pretty good job at slowing down the spread of the virus. And so I just want to congratulate everyone that's doing what they can to stay at home as much as they can and practice social distancing. So I think that there is opportunity now for us to for the county to consider looking at what the next step would be in phase 2, in stage 2, if we meet those criteria. So I'm very interested in looking at that and seeing what the best next step will be to allow more activities, more economic benefit, more social benefit, and still do what we've been able to accomplish so far, and that is continue to slow the spread of the virus.
Thank you. And another follow-up question on the positivity rate question. Do you have a figure for the positivity rate overall for Monterey County?
Yeah, so I'm looking, I think it's around 5, it's going to be somewhere between 5 and 6%, I believe.
And then how are you working with hospital coalitions? Is that work good enough to meet the guidelines the state is setting for expanding Monterey County to further into phase 2?
We'll be required to have plans to make sure that our hospitals have enough surge capacity, meaning that there is I believe it's a 35% increase in number of beds that the hospitals can fill with people who are hospitalized with COVID-19. And there's also we'll be required to submit our plans for our hospitals to have adequate personal protective equipment, primarily the N95 respirator masks and the gowns and gloves and the face shields. So all those plans will need to be presented to the state, and we have been working closely with our hospitals. We meet with all 4 hospitals on a weekly basis. We have a very lengthy agenda, and we could get a lot covered. And we also have a good working relationship with their infection control practitioners. Those are the individuals in each hospital that oversee and implement and enforce all the policies and protocols to prevent spread of COVID-19 in each of the hospitals. So we have a longstanding working relationship with those individuals. So I believe that with a little bit of work, we should be able to put forth a plan that demonstrates what we've done so far and what we'll continue to do within our hospital system to prevent spread and control the spread of COVID-19, not just in our community, but in the emergency departments in each of the 4 hospitals.
Thank you. And then a question about the contact tracers that has been asked before about getting more staff in to do that work. How are we doing on training up our additional staffers?
Additional staff. So all of our people working in case investigation and contact tracing have already been trained, and what we're looking at is bringing on at least another 20 people onto the team. So we're able to get to about 98% of the cases, and we're able to contact 98% of the contacts in Monterey County. And so we're meeting the demand there. So at this point, we have some ideas of redirecting additional county staff. We're also looking at maybe entering into some agreements with some agencies that want to assist. During this pandemic, we've received numerous offers from other agencies that want to do something to help out to respond to this pandemic. And so we're going to also start looking at some of those the officers that come in to see if maybe we could supplement our county staffing with volunteers or individuals from other organizations that might want to assist us.
And would that be part of that number 65, which is the number that the health department had set as needing to do contact tracing?
It could be part of that 65, or it could be more than 65. So the 65 is just the minimum that the governor most recently required of us based on a rate per population in our county. But by all means, we could have more than 65, which would provide some of our staff who've been working really hard take a little more of a break, and actually get back to some of the other work that we do in public health. We have a lot of other programs in public health that we don't talk about anymore, unfortunately, because it's all about COVID-19, but that work still has to continue. There's still TB, tuberculosis control. There's HIV programs, HIV treatment programs, HIV referral programs. We have Safe Routes to School. We have the tobacco control program. We have the WIC program, where we provide nutrition services to mothers and their babies. California Children's Services. There's just a lot of other things that we need to continue to do. And if we have more than 65 folks working assigned to or able to do contact tracing, we might be able to redirect some of our staff to give them a little more time to get back to some of the work that we also need to do in public health.
Thank you. And if I could, there's a request for some clarity on numbers of contact tracers. You mentioned 20. How many contact tracers are currently trained and working to do that particular task? You're muted.
So we have 34, and we're going to have another 12, and they may have already started. We need about another 20 folks to get close to what the state has required of us.
Thank you very much. Are there any other questions for any of our participants today? I'm not hearing any, and I have no other questions coming through. So that will wrap up our media briefing for today. Thanks very much for joining us. Our next briefing will be on Wednesday. See you then.